Welcome to Matflix, video streaming from maternity experts. My name is Dr. Jenny Hall. I am the box sets curator at Matflix, a fellow of the Royal College of Midwives and a former editor of The Practicing Midwife. At Matflix, we bring together videos of talks from top maternity experts into box sets to support your continued professional development, study and revalidation. It is a perfect study accompaniment for midwives, maternity professionals, midwifery students and anyone thinking about a career in the maternity services. My job is bringing together the latest thinking area by area so you do not have to. Not only do you get the video of brilliant talks and relevant content in thematic box sets, you also get access to the audio version so you can listen on the commute or while you walk the dog. Plus links to the latest research in the relevant field, government policy documents, the presenter's PowerPoint and more besides. Sign up to Matflix now for the best video streaming from maternity experts.
It's always a pleasure to be here, and I always try as hard as I can to support this excellent platform that's so flexible, that's responsive, that's contemporary, that's in people's homes, in people's pockets and in people's hands, wherever they happen to be.
I'm Nicole Rajan Brown. I'm a proud midwife and I'm proud to be supporting the Maternity and Midwifery Forum, who have helped me to grow, and for creating wonderful professional digital and online resources for midwives across the globe. The Maternity and Midwifery Forum ran their programmes free and online all through COVID. Now we want to grow the catalogue, spread it worldwide and keep it free to use for students and staff. To do this, we have launched a fundraising appeal to help keep all of the 8 wonderful maternity and midwifery festivals free. Keep the weekly Maternity and Midwifery Hour and the weekly newsletters free to midwives and maternity staff. You regularly tell us how much you value these free resources, so do give what you can.
Sorry? Yeah, we've tracked that. No, earlier when I tried to launch PowerPoint, it all froze and shut down, which never happens, because I use PowerPoint all the time. But
Welcome to Matflix, video streaming from maternity experts. My name is Dr. Jenny Hall. I am the box set's curator at Matflix, a fellow of the Royal College of Midwives and a former editor of The Practicing Midwife. At Matflix, we bring together videos of talks from top maternity experts into box sets to support your continued professional development, study and revalidation. It is a perfect study accompaniment for midwives, maternity professionals, midwifery students and anyone thinking about a career in the maternity services. My job is bringing together the latest thinking area by area so you do not have to. Not only do you get the video of brilliant talks and relevant content in thematic box sets, you also get access to the audio version so you can listen on the commute or while you walk the dog. Plus links to the latest research in the relevant field, government policy documents, the presenter's PowerPoint.
And welcome everyone to this week's Maternity and Midwifery Hour. Now, my name's Sue MacDonald and I'm the curator for the Maternity and Midwifery Hour and the Maternity and Midwifery Festivals. And it's my pleasure to be chairing this edition. Now, I have to remember it's week 6 of season 15 of the Maternity and Midwifery Hour. And I'm so delighted to be joined by two lovely midwives, Emily Edwards and Nicolette Porter. And many of you will know Nicolette and Emily, and it's so lovely to have them with us this evening. And of course, what we always do to our guests is ask them to share with us a moment of the week. And I'll start with Nicolette. They're looking very glamorous on that lovely setting. Well, I think it's a chaise lounge there. Well,
Thank you. Yeah. My moment of the week was, well, other than the London Maternity Midwifery Festival last week, which I really loved, but my moment of the week was that I went to go and see the Devil Wears Prada theatre production in West End last week. It was very, very good.
excellent. And would you recommend it?
I would. I think we're so lucky. I live in London to have the theatre right on my doorstep, so I love using it every now and then.
Fabulous. And of course, for the other people in the UK, there's always these streamings that they're doing a little bit more of, which could be a really good way of accessing fantastic productions. Thank you, Nicolette. That's lovely. Thank you for sharing that. How about Emily? Can you share a moment?
I would say my moment of the week is that I found out that I should be getting a new puppy in the next couple of months. So she's going to come and join my my 4-year-old golden retriever. So it's very exciting.
Oh, it is exciting. My goodness, you're going to have to get used to a little bit of chaos again.
I think I'm not the one who's going to have to get used to it. I think the 4-year-old golden retriever is going to have to get used to it because she's very settled in her ways.
All right. Well, that should be great fun. I think with the little baby creatures, when they join you, you laugh a lot and you have to go upside down. It's just like baby children, isn't it, really, in a way? Chaos will reign. So thank you so much for Emily and Nicolette for sharing their moments. I'm just going to do the usual sort of little welcome. And I was talking to Nicolette and Emily about the maternity hour, because I always at this point say we were born right at the beginning of the first lockdown in the UK for COVID-19, when we were very aware that midwives, student midwives, everybody in the maternity service, and obviously that's our passion and our love, so that's what we focused on. And we were very aware we couldn't have study days or conferences or events. And Zoom was sort of starting. We had some Zoom capability, obviously, and we show that now. But we wanted just to put something on for midwives and student midwives and maternity care support workers, etc., just so they could connect, get information and get some opportunity for continuing professional development. And initially we focused a lot on COVID and a lot on service developments and a lot on what was happening in education, which is our two colleagues' passion, I think, also. and about the changes and what people were doing and how people were coping. And it was fantastic at that point, I have to say, overseeing it, to see what midwives could really do. We did some fantastic things and just got on with it. And it was a very stressful time. And every now and then I'm reminded of that, because it's now 5 years ago. My goodness. And we're in our 5th year and we're still going. But of course, we're not doing so much on COVID now. We're doing other things, and people still seem to want to keep us, which is lovely for us. Now, the other thing I need to mention is this is all looked after by Matflix, who keep everything, all the records and recordings. So if you are doing a project, dissertation, any study, or you just want to improve your CPD access, we've got a vast collection of wonderful video clips that you can access through Matflix, and you will see on your resources list and a link to the Matflix, so you can see what we can offer. And obviously every week we do our Maternity and Midwifery Hour, and that gives you a little flavour of what is other things are available. Massive amount, all our festivals that are recorded also, and that's really useful. So if you have a power cut or something goes wrong and you have to rush off or you're on call, you can catch up later. And this recording for today will be available on Friday morning as a podcast, 6 o'clock in the morning, and then next Tuesday on the newsletter link, so you can catch up. The other thing to say is we love you to share. So you'll learn a lot this evening, and it's good if you can share it with other of your colleagues. This is an important issue. And it's really good, and it'll help with your learning and understanding to be able to share it with your colleagues. So do share. So that's grand. So I'll say also a big thank you to our midwives, student midwives at the moment, all working, and it's cold, and there's a lot of strange bugs around, and therefore there's sickness and people are having to cover for other people. So thank you for all that you're doing, and you're all fantastic anyway. So that's that for there. Now, my news this week, I haven't got a huge amount, just that we're LGBT History Month. We're also, the 20th of February is the World Day of Social Justice. And other than that, the two things that I've linked up and I've put on the resources sheet are one, the first one is the RCM, Royal College of Midwives Research Prioritisation Survey Part 2. Many of you will have participated in the first bit, and they've kind of narrowed it down. So there's an access to the next bit. It shouldn't take a long time to do, but do access it and put your 2p in, or 20p worth, or however much, because you need to have a say, because this will hopefully drive the midwives' research agenda. It's the things that are important to midwives, and also obviously to women and their babies and families. So do put down what you think. I haven't done mine yet, but I'm going to, probably after the hour, the fastest hour in the week, as I always say. The other thing is there's an interesting alert from the National Institute for Health Research, and this is, can we improve care for women at risk of early birth? And this is all about a preterm birth pathway. So this is quite a useful link to know about. And again, the link is on the resources. And this study, and there's an access to a kind of easy English breakdown of the study, and also the whole study. Both of them are there on your list. But I found this interesting. This study reviewed and made suggestions on how to implement the actual pathway for preterm birth dealing with preterm birth. And this was better staff training on early birth and the pathway, multidisciplinary preterm teams, and women-centered care. And then they've got a whole lot of ways of improving care at that link. So do access that as your bedtime reading. And I'm almost ahead of myself today, because I'm so keen to get on to the topic for this evening. So we're looking at neurodiversity in midwifery, and this is about creating supportive learning and care environments. And this includes a discussion of how we can support autistic women and birthing people in the perinatal period. And it's also exploring neurodivergence in midwifery, creating inclusive education and workspaces. Now, I'm going to just do a kind of edited highlights of our lovely speakers, because they're got a nice chunky CVs. They've achieved a huge amount. And I want to give them as much time as possible to talk about what they are going to be talking about. So I'll start with welcoming Emily Edwards. She's an autistic senior lecturer in midwifery at the Middlesex University and a neurodiversity advocate. She focuses on developing innovative, inclusive and accessible teaching and learning resources that have been implemented across the NHS and in higher education. And really, and you'll see from when she talks, her tireless dedication to improving accessibility and neurodivergence acceptance have led her to be achieving institutional and national awards for the work, and a greater knowledge being shared across the board. So welcome, Emily. The screen is now yours.
Thank you so much, Sue, for inviting me to come and speak to you about a topic that I believe should be a priority when thinking about staff and student wellbeing, and particularly within the current climate when we're considering the retention of midwives and the composition of the future workforce. So as Sue said, my name is Emily and I'm a senior lecturer in midwifery at Middlesex University, and I'm going to be talking to you about neurodivergence. Now, many of you may have heard this word, and some of you have a personal connection with neurodivergence. And the reality is that we must address it to ensure that we have a healthy and diverse workforce. The People Plan for 2020-2021 promoted a vision that placed a compassionate and inclusive culture at the centre of the NHS, and it highlighted that all NHS employees and employers are accountable for tackling bullying and harassment. However, the more recent NHS long-term workforce plan draws on evidence that demonstrates that staff with one or more protected characteristics are twice as likely to experience discrimination and bias. So to explain to you why I'm so passionate about raising my voice about neurodivergence, I want to give you a few key statistics. According to the research, about 1 in 5 people are neurodivergent, so that's approximately 20% of the population. But this figure is thought to be higher in healthcare workers because the medical field self-selects for many neurodivergent strengths, such as hyperfocus, curiosity, self-motivation, and an attention to detail. And really shockingly, a recent study has shown that around 1 in 2 employers report that they would not employ someone from at least one of the neurominorities. And the greatest bias is towards people with autism, ADHD, and Tourette's. Women, people from the global majority, and the LGBTQ+ communities are chronically under and misdiagnosed. And that means that our students and staff working within the maternity services are really often unable to receive the support and the adjustments that they require. Now, I think a really interesting thing about neurodivergence is its innate intersectional characteristic. You can be neurodivergent regardless of your age, your race, your sex, your gender, or your religion. And so I think that the neurodivergent community, both within our workforce and the service users that we care for, needs better visibility and awareness so that we can make sustainable changes. But really, to understand why I'm dedicated to raising my voice, I need to give you a little bit of personal context. I'm autistic, as Sue said, and with this has come certain challenges, but I also feel that there are great strengths that have come along with this. I am constantly trying to navigate a world that can be very overwhelming, overstimulating, and quite confusing for me. And through discussions, I've realised that many of the things that might be taken for granted in your everyday life, so something as simple as an interaction with a colleague, or answering an email, or talking to new people, or even meeting up with friends, these are all things that I will have thought about deeply and rehearsed many times in my head before actually undertaking them. And ultimately that comes at a cost, and sometimes that's exhaustion, but sometimes in more severe cases it can be burnout. So that you can begin to understand what it could be like to navigate working in a busy practice environment for a neurodivergent student or midwife, I want to share an animation with you. I will put an immediate disclaimer on this because there will be a very loud noise at the beginning. And I've done this in conferences before and I didn't give the trigger warning early enough. So I want to warn you, if you're wearing headphones or if you're noise sensitive, please be warned and remove them or turn the volume down on your device. I'm going to start it now, so please be warned.
I'll be handing over Mrs. Khan in Bay 3. She is Gravida 2, Para 1 with 1 previous cesarean section. She is 37 plus 2 today. Mrs. Khan came to triage at 5 p.m. today with some spotting and was admitted for observation. Observations are within normal parameters and there was no pain during abdominal palpation. She has had a CT check with the registrar done to her. Jane. It's really busy on the ward today, and you haven't had a break in a quiet area for hours. Would you like some help?
Okay, so Nicolette and I actually created this animation as part of the RCM's Neurodiversity in the Workplace e-learning module. Please be aware that this animation does not represent every autistic or indeed every neurodivergent person's experience, but hopefully it can give you just a little bit of insight. This is also an example of the animations that we have used in the e-learning that we published on NSHE e-learning hub a couple of months ago, and I'll tell you a little bit more about that a bit later on. Now, the main issue that we encounter in the UK is trying to get a diagnosis. To give you a personal example, when I moved to the UK, I already had a historic diagnosis from France, but this was not accepted here. So I began the diagnosis gauntlet, and after being moved from service to service for 3 years, I decided to get a private diagnosis. And I concluded that diagnosis in the UK is a privilege and not a right, because it cost me £2,700 to finally be diagnosed. And as a side note, this is an experience reflected by many students and qualified midwives who recognise that they're struggling, but then they struggle to get a diagnosis and the correct support. So if you are a manager and you're listening to this, it's really important to note that self-diagnosis is perfectly acceptable. And with a letter from a doctor stating that you're seeking diagnosis and that you're on a waiting list, you can access support through Access to Work and meet with occupational health to have reasonable adjustments put in place. And students can also access support through services at their university, and they're entitled to support from the DSA. One of the ways that I wanted to use my voice was by being a role model for my students. And that has meant having to be quite vulnerable about my own experiences, which isn't always an easy thing to do, I will admit. But I observed really early on in my academic career that many of the midwifery students leaving the course in the first 2 months, and particularly upon starting their first NHS placement, were neurodivergent. And that was evidenced by their learning support forms. And this really concerned me because the individual student would leave due to a lack of reasonable adjustments, but also they would feel as if they'd failed. And it's also hugely impactful for the profession because we know that we need to work on retaining future midwives. And ultimately, they were quite simply falling through the cracks. And it's continued to be clear to me through the online forums that I take part in and the projects I've led and the people that I've spoken to, that neurodivergent students and midwives want to feel as passionately about their jobs as they did when they started. But the reality is that many of them feel unseen and unheard, and they're encountering huge barriers to support in practice. And ultimately, that's leading to them questioning if they have a place in the NHS, and many are leaving, which I think is devastating on so many levels, both personal and professional. So it was really essential, with all of this in mind, for me to start tackling the societal taboo around neurodivergence and to build collaborative projects that ensured that the voices of our neurodivergent colleagues were heard. So some of the recent projects that I've led were the development of the RCM iLearn module on neurodiversity in the workplace, and that was released in March 2023. It's accessible to all RCM members. And this then led to leading a stakeholder group of neurodivergent students, midwives, and academics, and collaborating with the RCM to develop the Neurodivergence Acceptance Toolkit for Midwifery Education. And that was launched in March 2024 at the RCM conference, and it's been shared with higher education institutions and trusts across the UK. A more recent project, following funding from the Repair project, enabled me to work with neurodivergent students from across the UK And we developed a series of animated e-learn modules for any healthcare professional who might be working with and or assessing healthcare students. Now, this one is freely available on the NHSE e-learning hub, and I think it's a really useful tool for staff to explore during update sessions or during practice supervisor and practice assessor sessions or any other staff sessions on cultural awareness. If you are listening in and you're wondering what you can do to create a more inclusive working environment for your co-workers and the students that you work with, a really good place to start would be by completing these e-learning modules on the RCM iLearn and the NSHE e-learning platforms. Because I think listening to people's lived experiences and educating yourselves about the small adjustments that can be made would be a really good start to making a difference. It isn't really just about awareness, because we really need to start to take action. So where are we now? I wanted to use my own lived experience to power discussions and implement concrete change. And over the past few years, numerous networking opportunities have led in turn to engaging conversations with midwifery leaders from all over the country. But the conversations that I've had have shown that although EDI policies are in place and certain trusts are leading specific initiatives, institutions are globally unsure about how to concretely support neurodivergent colleagues, and that ultimately leads to inaccessible and non-inclusive working environments, and people are leaving the workforce. In 2023, I joined the Capital Midwife Preceptorship Framework Update Task Force, and it aimed to review preceptorship guidance. And I was able to give perspective and review the guidance through a neurodiversity lens. And I really hoped that this would drive positive change within the preceptorship process and challenge NHS leaders to improve accessibility and inclusion. But I do think that there's still vital work that needs to be done in this area. And as I said earlier, I'm in multiple online forums and Facebook groups with neurodivergent midwives and students from across the country, and many are struggling and considering leaving their studies or the profession, or already have left. For example, students are not getting reasonable adjustments allocated to them for assessments because there's still the misunderstanding that this would give them an unfair advantage, or that they've been told that they wouldn't get extra time in practice. So if you're an educator working within an HEI, I highly recommend looking at the RCM's Neurodivergence Acceptance Toolkit to support you to improve accessibility for students from recruitment all the way through to reviewing your curriculums and your assessments. The argument about unfair advantage has the following counter arguments. Firstly, students are entitled to reasonable adjustments as per the Equality Act. And I also want you to consider that in hospital, in an emergency, you would not be alone and you would be able to count on the multidisciplinary team. So we need to take these things into consideration. Neurodivergent midwives are also struggling to get the appropriate support to be able to do jobs that they are passionate about and feel really driven to do. And if you're one of these midwives, please rest assured that there is ongoing work to improve working conditions. I spoke to leaders at the NMC just this week, and I know that among other priorities, they are beginning to examine the experiences of students with additional learning needs in practice. I'm also continuing to work really closely with the RCM to begin to develop guidance to support neurodivergent midwives in practice, because I have heard what midwives have to say, and a lot of the work that's been done so far has been focused on students. So I would like to say that we are now also aiming to work around midwives in practice. And I've also met with the heads of, with many of the heads and directors of midwifery across the UK to raise awareness. So if you're a midwife and you're struggling in practice, I recommend that you reach out to your PMAs. Ensure that you've applied to access to work and that you've spoken to occupational health. The PMA network are huge allies for neurodivergent midwives, and I've spoken to many of them, and they are really incredibly keen to support you in practice. So I'm going to end by saying that this has been a grassroots movement from the ground up, but what I think is missing is tangible policy change and support from the top down. I think that neurodivergence is one of the major strands not being addressed when it comes to staff and student retention. I'd like to see more concrete policy and guideline changes made to ensure that people with protected characteristics can thrive in education, as well as within the NHS, whether they are working or accessing services. So thank you very much for listening. And of course, I'll welcome any questions at the end once we've heard from Nicolette.
Lovely. Thank you so much, Emily. That was really useful. I mean, some of the figures you've provided are quite stunning. And I'm sure that our audience are going to be thinking about that. If not, I've got a question or two I'd like to ask afterwards. So we'll go on to Nicolette now. Now, Nicolette, many of you will know Nicolette. She came on the Maternity Hour as a student, not so long ago, but quite a long time ago, as this 5-year thing. And so, of course, she's a midwife and postgrad student pursuing an MSc in women's health at UCL in London. She was awarded the Nursing Times Student Midwife of the Year in 2021, and she's also served as an editor of the Student Midwife Journal. Her professional focus lies in enhancing inclusivity and accessibility in perinatal care, with a particular emphasis on supporting autistic women and birthing people, and is currently developing the Unmasked study, which I know that she's going to talk about this evening. So welcome, Nicolette. The screen is yours, and thank you very much for coming this evening also.
Hi, thank you so much for having me. So as Sue said, my name's Nicolette Porter and I'm a midwife based in London. So today I'll be talking to you about supporting autistic women and birthing people in the perinatal period and my research in this area, because it's a group that's often overlooked. So this is an area of both professional and personal interest for me, as a neurodivergent midwife myself. And you can see a picture there of me when I was a student, 19 years old, fresh-faced, my first time wearing my uniform, and I was so proud. But I also, under the surface, faced a lot of challenges, similar to the challenges that Emily outlined in her excellent presentation. So I experienced social challenges, adjusting to interacting with colleagues and clients and understanding the unspoken hierarchy in a hospital setting, and routine challenges, learning to adjust to a very unpredictable hospital environment, and sensory challenges. The bright lights, the loud noises, the chaotic nature of maternity services often led to quite daily sensory overwhelm. And this experience really sparked my interest in the autistic birth experience, because despite all my struggles, I couldn't stop thinking, well, I'm not in the most pain of my life right now. I'm not vulnerable. I'm not in labor. And how must this feel for an autistic birthing person? So that's why I started looking into the experience of autistic birthing individuals from a research perspective. But to really understand the autistic perinatal experience, I think you need to look at the broader context of autism in healthcare, because the evidence does suggest that autistic individuals have unique healthcare needs and that sensory sensitivities can impact their experience in these healthcare settings. Things like their communication difficulties or differences can affect patient-provider interactions, and things like routine changes or disruptions, which we know are common in healthcare settings, can be quite challenging and distressing for some autistic patients. Things like anxiety and sensory overload can be quite a common occurrence in medical visits, or even leading up to medical visits, meaning that people might be worried to even interact with the services to begin with. So I kind of wanted to see, does this kind of context of autism in healthcare translate over to perinatal care services? So that's kind of why I was interested, because there's a lot of disparities that we know exist in autism in healthcare. Autistic people face significant disparities in healthcare compared to non-autistic people, reporting lower satisfaction with healthcare staff communication and higher odds of unmet service needs relating to their physical health, mental health, and prescription medications. So, as part of my undergraduate dissertation, I did some research as a literature review into this area. Now, I can't go into all of the findings in this segment, but feel free to read a little bit more about what we found in a co-authored article with myself and Emily, which you'll find in the resources list at the end. But I will pick out some things that I think you might find quite interesting, some themes that emerged from this review. And one major theme that emerged was communication breakdown. Communication difficulties during childbirth, particularly, were noticed, which were linked to things like stress, pain, lack of control, the routine change of it all. And this immense stress could lead to stress-induced shutdowns, where patients felt challenges in verbalizing their experiences. And you can imagine that if you feel it's difficult to verbalize your experiences and your needs, that can compromise things like informed consent. And it's really critical to think about communication breakdown between patient and provider and trying to meet people where they're at, because a lot of the participants in these studies were reporting that not feeling understood by healthcare staff made them want to disengage from these services. And we know it's concerning because missing antenatal appointments can be linked to adverse outcomes. Another key theme that emerged was, quite interestingly, misinterpretation of pain levels. Now, some autistic individuals have different ways of perceiving and expressing pain, and this might be due to interoception differences, causing struggles in interpreting internal bodily sensations. So then this is why some people found it difficult necessarily to express verbally the pain that they were in. And this underscores why we shouldn't just be relying on typical body language or typical expressions or facial expressions to measure the need for things like pain relief. And another significant theme that emerged was judgment from healthcare professionals. And some participants reported feeling, quote, treated like a joke or overruled in their choices. And they described being violated and powerless. And many participants felt judged and stereotyped by health professionals, receiving unwanted attention, not attention in terms of support, but attention from social services or safeguarding, or the assumption that they would be less good mothers. And I really pointed to perinatal mental health here in bold, because you got to think, what's the impact of all of these things? And we know that negative experiences can have significant implications on your mental health. And by having birth traumas, these can be caused by psychological distress in this area. And this really does translate to the research, because research suggests that autistic women have an increased likelihood of prenatal and postnatal depression, which was found by a study by Pohl et al. In 2020. So as midwives, we have a responsibility to provide psychologically safe spaces for these women. So it's not all doom and gloom. I did want to give some recommendations that came out of this review. So following the review, I did make some recommendations. This was done back in 2020, so context of the pandemic, but some of them are still very much applicable today. So one of the things we recommended is having that accompanying partner, which you can imagine in the COVID times wasn't always facilitated. And having that accompanying partner can really help to reduce your anxiety and to facilitate advocacy for their birth choices, especially when you have things like stress-induced shutdowns. Having autism awareness training, and also not just awareness, acceptance, because it's really important to have training emphasizing the importance of respecting differences and making those reasonable adjustments. I also recommended the introduction of the role of a specialist autism or neurodivergent midwife. And this is because we need to ensure that needs are being met in this area. And you would have a bereavement specialist midwife, you would have a diabetes specialist midwife. So recognizing that there are health disparities in this area, I think that the introduction of a role like this could be really beneficial to these women. Another recommendation was alternative information formats. Offer alternative ways of receiving information. Leaflets, videos, providing step-to-step instructions, avoiding vague language so that people can go in their own time and listen again to those health information. Things like that. Providing extended time for appointments if they have needs where they need longer time to interpret information, for example. And then the next recommendation was quiet rooms. Consider quiet rooms in labour, because some of the participants reported having noise sensitivity, meaning that they could hear the women or the beeps and the buzzes from the equipment next door. So even considering things like soundproof rooms or placing individuals with noise sensitivity at the end of the ward, for example. And I think the key thing here is really just tailoring the environment to meet the individual needs of autistic individuals, because no autistic individual is the same. So consider things like a home visit appointment if sensory overload is a concern when they're going to clinic environments, for example. Find out what is most necessary for that individual and tailoring things to support them. Things like continuity of carer came up as a really big recommendation. And that's because if you need that routine, if you need that structure, going through the maternity services with the same person can be really beneficial. And if you have the same person, they can understand those nuanced changes in the way that they're communicating. They might be able to pick up on, oh, they weren't acting like this 2 weeks ago. Is this normal for them? What's normal for that individual? And you can see that a lot of these recommendations are just good midwifery practice. And that's the thing, that universal design benefits everybody, not just autistic individuals, but everybody using our services. And you might be thinking, yeah, well, this is all well and good, Nicolette, but is this really relevant to my practice? And the answer is yes. The evidence suggests that more than 1 in 100 people are autistic, according to the British Medical Association. And in fact, this is a massive underestimate of the true figure, which I'll go into a little bit already, but Emily already touched on it. And that's about 700,000 people in the UK. And to put this into context, you're just as likely to interact with an autistic person or their family as you within your role as a midwife as you are to experience things like preterm birth before 34 weeks. The incidence of that is about 1 in 100. Or a case of shoulder dystocia is about 1 in 100 to 1 in 150 vaginal births. So comparable numbers. Or twice as likely to experience something like birthing identical twins, which is about 1 in every 250 births, right? So we receive extensive training on obstetric complications. I remember shoulder dystocia was drilled into my brain in my OSCEs and things like that. Yet there's no mandatory training as a rule of thumb until recently on things like caring for autistic individuals. So I talked a lot about the 1 in 100 statistic, but there are a lot of factors affecting those prevalent statistics that I did want to just briefly touch on, because this is massively underrepresentative of the true figure. A lot of people experience delayed diagnosis because things like stigma still exist and lack of recognition still exist, and also those years-long waiting list. So our most recent statistics in this area suggest that as of September 2024, there's 200,000 people on the autism waiting list in England alone. Yeah, so a lot of people might still not even have access to a diagnosis. However, we have seen a massive increase because of increased recognition recently. So there's been a 20-fold increase in reported autism over the last 30 years. And that's been massively attributed to changes in the diagnostic criteria, which has involved like an amalgamation of a few different conditions under the umbrella of autism. And there's also been increased awareness for diagnosticians to learn about the variety of ways that autism can present. And how some autistic individuals, especially autistic women, may mask some of their autistic traits for increased social acceptance. And that change and that increased recognition has caused a lot more autism diagnoses over the last 10 years or so. So it's not that everyone's autistic nowadays, as I've heard a lot of people say, it's because we've got a lot better at recognizing it. So the key message here in all of these stats that I really wanted to get across to you is that you will care for an autistic person at some point in your midwifery career. You just will. If they've been diagnosed or even if they've not been diagnosed, you will be caring for autistic clients. So as midwives, we have a duty to provide safe, inclusive, and respectful care. But yet, to date, there has been no research in the UK that has explored midwives' knowledge, confidence, and attitudes towards caring for autistic birthing people. So that's where my current research comes in. So my current research, which is called the Unmask Study, addresses exactly that: midwives' knowledge, confidence, and attitudes towards caring for autistic birthing people. So the key aim here is to identify where the specific training needs are. And to do this, I'm conducting an online survey of UK registered midwives. It's just a 10-minute survey, mainly true or false questions, very straightforward to complete. It's completely anonymous. It's received ethics approval from the UCL Ethics Committee, and it's open to all midwives, whether they have personal experience of autism or not. We're wanting to get a really broad range of people answering this survey. So I'd love for as many UK registered midwives to participate as possible. You can scan the QR code on the screen, or you can use the link, which will be in the resources pack at the end. Or you can contact me on social media and I can give you the link. It's plastered all over my social media. The thing with this survey is that at the time of recording, it is open for another week and a half. It closes on the 2nd of March. So if you have a little bit, 10 minutes after the time this hour's finished, if you could just complete the survey, that would be amazing. And it's really important because we're trying to capture a spectrum of views so we can get a comprehensive understanding of what really needs to change in perinatal care services for these women. And it's important to hear it from the voices of midwives. So to gain statistically significant results, we need a sample of about 400 midwives. And 280 people have been kind enough to already do it. So we really appreciate that. That's about 75% of our sample. So thank you so much for everyone who's done it already. But if you haven't, I'd really appreciate if you could complete our survey, because your insights will help to shape future training and policy in this area. And I think that together we can create evidence-based improvements in perinatal care for autistic women and birthing people. So I have my resources at the end. It also has the link on there if you want to complete it. And I'll hand it back to you. I'm happy for any questions. I'd love to continue the conversation in this area.
I tried to unmute. Sorry. Thank you, Nicolette. That was fantastic. And to Emily also, that's given us some really good, solid information. Well, solid when you're talking about 1 in 5 people in healthcare being, potentially autistic or neurodivergent. I mean, people say on the spectrum. Is that acceptable terms or perhaps not?
Different people accept different things. I think that that's the ultimate. It's always difficult to know exactly what terminology to use. And I think the most important thing that comes out of that is just ask people. I think a lot of autistic people, for example, prefer identity first language rather than person first language. So autistic person rather than a person with autism. That's what research shows. But equally, I think that we just need to be, asking people what they prefer. It's as simple as that.
Yes. I mean, it's actually quite very interesting because with both of you talking, giving the sort of picture from your different perspectives, and Nicolette, I think that point about those having those recommendations and what autistic women need, or actually women with maybe with an autistic partner, the issues I guess are the same, aren't they? And actually making sure those particular principles were included for all women would achieve the same. Well, it would achieve a better care for everybody, which would be fantastic. Because the thing that I was thinking as both of you were talking, well, we don't, if I've jotted down, how would you know you were neurodiverse? And I'm sure some people who are watching now will be thinking, oh, I wonder if that's me. Because I know when some famous person says, oh, I've been diagnosed as neurodiverse or autistic, they often have a long story of thinking they didn't quite fit or that something was different about them. And you talking about the difficulty, especially Emily, of getting a diagnosis and having to get your own private diagnosis achieved, made me think there's going to be a lot of women. We don't know when women come for care, whether they're autistic or not. For some of them, they wouldn't know. Maybe just something to think on.
That's the truth. It is true. I mean, there's I think there's also all the stigma around disclosure, which Nicolette also touched upon. So some people may know that they have a diagnosis, but may not wish or may be fearful of disclosing it because, they might have had poor experiences in the past that lead them to feel that actually maybe disclosing it is not safe or not, not what they want right then. So, there's a lot, it's a very, very complex, there's a lot of complexities around that topic of disclosure.
Fantastic.
Absolutely.
Well,
and sometimes we don't even fully ask the question. In the booking appointment, we ask them everything under the sun. Do you have gastro issues? Do you have cardiac issues? But knowing how common autism and how common any type of neurodivergence is, sometimes I don't think we always ask the question at booking so we can put them on the right care pathway and make the reasonable adjustments we need to them. Knowing that right at the beginning, we don't even ask the question all the time.
And is there somewhere on the computer program that we can tick?
It should be integrated. We don't have that.
There's often a conflation between mental health and neurodivergence.
That's what I'm thinking. Yeah.
Two very, very separate, distinct things. There can be intersectionality between the two, of course, but it's two very different things. And the question around neurodivergence is almost never asked.
Yeah, so everyone who's watching can see how complex it can be. Now I've got a comment. I also want to welcome Italy, Denmark, and Australia to the evening. Hello. And we have a comment from Katie Krebs. Hi, Katie. And Katie says, hello, Emily. Thank you so much. I'm joining from Brisbane, Australia. They're just proving it. I'm so excited to hear about your research and the changes you have been able to make. It'd be amazing if we could influence similar change here in Australia. So it may be useful, Katie, to access some of the references that Emily talks about, and maybe share this clip with your colleagues as well in Australia. Fantastic, thank you. And we've got and sorry I ought to say to people who are watching, if you haven't watched this before, the reason I'm looking away is because I have two screens and the questions are coming on my other screen. So Danielle says, I'm a nurse starting my 20-month midwifery at the end of March. Do I meet the criteria for the survey? Good question, Danielle. Nicolette, does Danielle meet the criteria?
That's a really interesting question. Unfortunately, I don't think you would be able to meet the criteria of the survey, only because it's registered for UK registered midwives who are on the NMC registered as midwives. But I'd really love it if you could share it within your network with midwives that you work with, if you really love the topic and you really want people to get involved. But unfortunately, you wouldn't be able to complete it yourself.
Okay, but Danielle, you know about it now, so you'll be able to when this study comes out in a nice shiny publication, you'll be able to share it with your student group. So fantastic. Thank you. And good luck with your 20-month training. It's going to be an interesting time. Okay, and I've got Zara Yassare. Hi, Zara. It says, through your research, did you look at women and culture and exposure in their culture if disclosure that they didn't feel able to divulge? I think that goes back to what we were talking about, the stigma. I don't know.
Yeah,
and I guess,
absolutely.
Nicolette, that's more for you when you were doing your survey, but it may fit what Emily's work also threw up.
So when I did the literature review, it did kind of come out that there was a lot of people who felt stigma related to disclosing autism and not feeling like it was a safe space. The thing with a lot of these studies, as is an issue with many studies just across the board, there is a lack of diversity in participants. So it's really hard to make cultural specific analyses relating to how trends in certain groups rather than others. And I think this is why it's so important to do some more large scale research in this area, hoping to get responses from a diverse group from across the UK. Because at the moment, there just isn't research allowing us to make specific cultural analyses for things like disclosure.
Fabulous. Did you want to add anything, Emily, or you?
No, I'm in
Okay
complete agreement. There is obviously that intersectionality that needs to be studied, but as Nicolette said, the paucity of research in this area. I mean, just to give you an idea, that there is no research around autistic student midwives. There just isn't. There's a small, but significant study around autistic student doctors. And I'm actually doing my PhD at the moment on the experiences of autistic student midwives, and I will be looking for participants in the coming months to, come and join my study. But it will be the first of its kind on autistic student midwives. So there really just isn't any research, and there needs to be more research done, and particularly there needs to be more research done by neurodivergent researchers, because the whole concept is nothing about us without us. And it's all well and good having researchers doing research on neurodivergent or autistic people, but what we want is it being done with or being done by us, so that, because I think it's hugely impactful. But no, Nicolette is right. There really isn't that much evidence around there. So a lot of this is things that we've seen or observed or felt, as the case might be for some things.
No, I mean that the idea of neurodivergent people being involved in the research makes absolute sense. And I guess it kind of mirrors what's happened in the past with people doing midwifery research who may not be midwives. you kind of know the question. You will know the questions to ask, won't you? That makes absolute sense. And Danielle, stand by to be involved in Emily's research, I guess, since you're going to start your training. That's lovely. Thank you. Now we've got Fiona Timlett. Hi, Fiona. Fiona says, thank you. Could I ask if you could signpost me to any midwifery guidance on this? I think that will go to Emily. Well, both you, because you've worked so closely on this together, haven't you?
We've done quite a few projects together. I mean, Nicolette will have a slightly different perspective, I guess, on the resources that she would share. Mine will mainly be around kind of students and midwives. I have left an entire list of resources with you, Sue, and I think you said that was going to be part of the resource pack. So from my perspective around, education and supporting colleagues and supporting students, that's where all my resources will be kind of looking at. But I think Nicolette's would be slightly different.
Yeah, no, absolutely. To echo what Emily said, Emily and I co-authored an article together in 2022, I want to say, and it was about how midwives, two articles actually, yeah, how midwives and educators can better support neurodivergent students. And I think this was a really important piece because we didn't only have like the voices of lived experience, people with lived experience in this article, but we also made some best practice points and recommendations. So I think for anyone who really wants an entry into this world, that would be a great resource to read. And like the clip that Emily played at the start of her presentation, that was an animation that we developed together, really using lived experience of how it feels as an autistic person to walk into a hospital environment. The idea that the sirens are just too loud, the light bulbs above you are just too bright, really to kind of give you that immersive experience of what sensory overload feels like. So I think just trying to read resources that have been developed by neurodivergent people can help give you an authentic kind of perspective and insight into this experience.
Yeah, absolutely. Well, I could feel the stress rising in all the sounds and beeps and everything. So that was a really good illustration. Thank you for that. Now, I'm moving on to Anna Marsh. Hi, Anna. Anna says, do you think integrating digital or social media into midwifery care provision could be a way to improve communication with pregnant women? Nicolette?
Yeah, absolutely. I think this is the way that the world is going. And I think that integrating digital technology into resources can be nothing but a good thing. I think that we have to recognize access to these things. Everyone has differences in access across socioeconomic backgrounds. But I think that the trust that I work at is actually doing a really, really great program of trying to give women data, like mobile data, who are using our services while they're pregnant. So just to get everyone on board to be able to use these online apps, information, things like that. I think that giving people resources in alternative formats is really important because not everyone learns in the same way. So why are we expecting everyone to receive health information in the same way? So I think that digital formats are important. I think that social media is important from validated sources. I think that, there's a whole movement at the moment about protecting titles of nurses. I don't know if you've seen. So I think in similar ways, when people are giving medical advice online, that should be discouraged. But in terms of just general kind of support, I think that should be encouraged. I think it's the way the world is going.
That's great. Thank you. Right, I'm going to move on. We've got lots of comments and questions. And Sarah Neal is making a comment. Hi, Sarah. And she's saying, my experience is that a lot of women gain insight into their own childhood experiences when they become mothers themselves. The fact that their children are gaining support starts a chain of events that leads to their own diagnosis. It's a good point, Sarah. And then another comment from Laura. Huge generation of women who don't know they're neurodiverse due to the historical bias in research, underlining the point our speakers have made. Hence, individualized care is hugely important. Thank you. That's lovely. Okay. And then we've got a long comment from Katie, again from Australia, who says, thank you, Nicolette. I'm a neurodivergent midwife in Australia and have seen the impact of ADHD and or ASD here in Australia for women, particularly, there seems to be a much higher risk of experiencing interventions and negative outcomes. My research interest is how we can screen women antenatally for neurodiversity, antenatally to provide better care and outcomes. I currently work in the Australian Nurse Family Partnership Programme and can see the impacts on the mothers I care for. More negative birth experience, postnatal depression and struggling to parent, as kids are often highly sensitive to birth. And that really underlines what both Nicolette and Emily were talking about. I don't know if you wanted to comment on Katie's comment. It's a big comment.
No, yeah, I have so much to say, but I'll try and keep it brief. It's so interesting. Like, there is more intervention. Obviously, we don't have any large-scale research on this in the UK, but there is quite a large-scale research in Sweden on autistic women's outcomes. So not experiences, but literal outcomes. And that one did find that there were higher likelihoods of elective cesarean sections. Now, we don't know the reason why. I don't know if this is more a pathway of anxiety, maybe needing to have that routinized understanding of what's going to happen at your birth. So we don't really know why that is, but I think that that's a really interesting area of future research. Someone before mentioned about how people don't discover that they're neurodivergent and or autistic until later on in life, especially when they have children of their own, and then they start seeing signs in that child, and then they think, well, that's exactly how I am. And then it's like this light bulb comes into their head, like, am I also autistic? And this is why it shows that people aren't getting the support that they need throughout their early lives, and they're only getting them when they're early 30s, let's say, you know? So I think that we can do a whole lot better in supporting these people, because these people could have 1 or 2 births without even realizing that they're autistic. And that brings in the point about screening or trying to offer diagnostic support. I think that isn't a bad idea. You know, when you go into university, a lot of people get diagnosed with dyslexia at university, for example, you know, because they only, when they're required to be having this extensive writing and reading, does their difficulties really unveil, right? So similarly, when you're having much more interaction with a healthcare environment that you've probably never had before, if you're quite a healthy individual, you might not even have really had more than a blood test. Do you know what I mean? So only when you go into healthcare services when you're having a baby do you need to have a lot of contact. And that might be the thing that makes these difficulties, these challenges really unveil themselves. So it might not be a bad idea to offer those services as well, if we could facilitate that.
And it makes it much more positive than if you were attending, say, accident and emergency, because a maternity kind of visit is going to be much more positive to start with. So it could be a better way of framing autism in somebody. Great, thank you. Okay, now we are, and I always say this is the shortest hour in the week. We've got Anna Marsh is asking, are there any research methods or data collection methods that you recommend when getting views, perceptions and experiences of neurodiverse women? This might be this might be Emily's turn.
I mean, I guess, you know, IPAs, like interpretive phenomenology, could be a really, really interesting approach to this, if you're looking at it from a qualitative perspective. I guess it just depends what you're trying to show ultimately. So it would be very difficult for me to give advice if I wasn't quite sure what it was you were wanting to look into. But you know, if you really want to hear about people's experiences in depth, then that could be quite an interesting approach.
Did you want to add anything, Nicola?
Yeah, I agree with what Emily said about IPA. I think it's most appropriate when you're trying to tease out information about people's attitudes and views. For my study, I'm actually doing completely different. I'm doing a quantitative analysis because I think that is really important to get some empirical data in this area, because we just don't have any. So I'm trying to fill like a gap in that way. But I think that traditionally trying to tease out people's experiences, I think that usually a qualitative route would be most appropriate.
Okay, thank you for that. Now I've got let me see, Anna saying, maybe instead of question asking about whether a client is neurodivergent, which they might not wish to disclose, could there be a question as to whether they have sensory needs, sensitivities?
I mean, anything would be better than what there currently is, which is nothing. So I guess ultimately it very much depends on, what trusts are willing to put in place, because I think it is quite trust dependent. I do know of a couple of trusts who have implemented questions within like their booking appointments and things like that, a variety of, variances of questions. And they've implemented those very successfully. But I think that they're probably few and far between. So I guess, I mean, ultimately, I think for most people, if you're asked outright, if somebody's taking the time to ask you outright if you're neurodivergent and that they care and they want to support you, then you're probably more likely to disclose. I've definitely had that experience with my students. I always disclose my autism to my students, and the result of that has been that a lot of students have come and disclosed to me because they feel safe to do so. And I think I'm not sure that we need to cloak the words neurodivergence, autism. These are not, bad words. I think the more we use them, the more we normalize talking about things like this, the more comfortable people are going to feel to disclose. That would be my personal opinion. So I'm not sure is the answer. I think anything is better than nothing, but I don't think it should be a complete barrier to use the words neurodivergence or autism or anything else, because obviously we've been talking about autism, but we've got to remember that neurodivergence is a big umbrella term for lots and lots and lots of different things. And, so I think we've got to just be a little bit careful not to conflate autism and neurodivergence.
Well, it's an increasing the public understanding of all the different varieties, because it's a wide spectrum, isn't it? So, no, that's grand. Thank you. Now I've got Kate Wilkins. There's only a couple more now because we are really running out of time. And Kate says, this is so good to hear. We're just getting a Neuro ND project off the ground, as there's nothing available at our trust for patients with neurodiversity. Thank you for sharing. So that's a big positive. Well done, Kate. And well done to your trust for doing that. And then we have a comment from Susan, who says, I feel unprepared for caring for people with neurodiversity. Any research to support pregnant people, their families and healthcare professionals can only improve the quality of service provided. Well, that's a lovely comment. Thank you so much, Susan, for adding that. And I think that'll be our final word, because we've grilled our speakers quite comprehensively. And I have to say, I think this would bear another visit a little bit later. Especially when Emily's working on her PhD further down the line and Nicolette's finished with gathering up her evidence. And I just will reiterate it. Just spend some time, have a look at that link and go in and try and do that survey. It won't take long and it will be really useful, and bump up Nicolette's numbers nicely, and she can get her work out to you, back to us as all. So thank you so much to Nicolette and Emily for joining us this evening. Now I'm going to also say thank you to Angelo, who's behind the scenes, as you know, making sure everything's recorded and it is perfect for you, just in case you did get called away and you have to have that podcast at 6 o'clock in the morning on Friday. I'm amazed by that myself. Also thanks to Paul, who's been bringing the questions through to me online, which has been really helpful, and I hope we've been able to answer all the questions and comments that you've had. And thank you, as always, to our wonderful audience for coming up with such good questions and such thoughtful questions. It really helps us to give some answers, but also helps everyone think a little bit more about quite a tricky topic, multi-layered and themed all the way through. So that's fantastic. So next week we're going to be looking at being positive about Down syndrome, looking at DS UK's work in maternity care with Nicola Enoch and Simon Prince, who's a parent. And so that's next week. So same place, same time. And in the meantime, stay safe, look after yourselves, and we'll see you next week, if not at the Midland Festival in May 20th. Seems a long way off. And also check out the RCM toolkit if you've got access to that, because that will also bring alive some other things that Nicolette and Emily have talked about this evening. So take care. See you next week.
Welcome to Matflix, video streaming from maternity experts. My name is Dr. Jenny Hall. I am the box sets curator at Matflix, a fellow of the Royal College of Midwives and a former editor of The Practicing Midwife. At Matflix, we bring together videos of talks from top maternity experts into box sets to support your continued professional development, study and revalidation. It is a perfect study accompaniment for midwives, maternity professionals, midwifery students and anyone thinking about a career in the maternity services. My job is bringing together the latest thinking area by area so you do not have to. Not only do you get the video of brilliant talks and relevant content in thematic box sets, you also get access to the audio version so you can listen on the commute or while you walk the dog. Plus links to the latest research in the relevant field, government policy documents